en español, por favor marquen el número 605-313-5170. Luego introduzcan el código 811-671 con el símbolo del número después.
Thank you so much. And we'll put that number in the chat box. So if somebody comes in late, we'll direct them to the chat box to find that number. Okay, so thank you everyone for being here. It's really, really wonderful to have such a large interest in this topic. We are living in an unprecedented time of crisis, and survivors of sexual assault and interpersonal violence are experiencing the impact of this moment in ways that we never could have imagined. April, as many of us know, was Sexual Assault Awareness Month, and for those of us who work in community or are a part of community, this past month has been very up in the air, and we've been working really hard to support our community members and get our services changed up through the shelter in place. So we weren't able to attend Sexual Assault Awareness Month events like we had hoped to or planned to. So that's why we're doing this panel now. And May is Mental Health Awareness Month. And those two issues are deeply connected. So it seems very appropriate that we're talking about trauma and sexual violence during this time period on the cusp of April and May. So my name is KellyLou Densmore. I'm the director of the Office of SHARP. SHARP is the Office of Sexual Harassment and Assault Response and Prevention. And we're a brand new office in the city, and we're dedicated to holding city agencies accountable for how survivors of sexual violence are treated. So that means if you are a survivor of sexual violence and you attempted to bring your case to a San Francisco agency, such as the hospital, the police, the district attorney, it could even be something like the probation department or the homelessness and supportive housing department, any city agency, and you had a bad experience, or you felt like you weren't believed, or you weren't heard, or your case wasn't handled properly, you can contact the SHARP office and file a complaint, and we can look into, do some investigation and advocate for you to have a response that ensures your dignity and respect as a survivor. So the best way to contact SHARP is by calling 415-252-2512, and I'll put this in the chat also. Or you can email us at sharp@sfgov.org. And then I'm one of your co-facilitators this evening, so I'm thrilled to be sharing this role with Dr. Miry. Are you here?
I am here. Hello.
Hi. I'm going to pass it off to you.
Thank you. Hi, everyone. I'm a psychologist here in San Francisco. I also serve on the San Francisco Commission on the Status of Women. The Department on the Status of Women was established in San Francisco in 1975 to really promote equitable treatment and foster the advancement of women and girls throughout San Francisco through policies, legislation, and programming. The department's programs are really organized around the framework of the United Nations Convention on the Elimination of All Forms of Discrimination against Women. The department has a $9 million Violence Against Women Intervention and Prevention Grants Program. This funds community-based organizations, which then in turn provide girls and women with emergency shelter, transitional housing, crisis lines, intervention and advocacy, legal services, and prevention and education to survivors of domestic violence, of sexual assault, and human trafficking. We've been working very hard to continue the work and support of our community partners at this time and address emerging needs for girls and women during the COVID crisis. So from here, I think I'll love to ask the panelists to introduce themselves, maybe take a couple minutes each to share a little bit about yourself, your background, and your organization. And feel free to jump in.
Well, I'm happy to go. I'm
First, why
Sarah
don't we
Metz.
start? Why don't we start with Nicole Santamaria, if she's here?
Yes, I'm here. Thank you. I'm Nicole Santamaria. I'm an asylum seeker from El Salvador. I go by she, her, hers pronouns. And I'm the ED at Ela para Trans Latina, an organization that is based in San Francisco. And right now we have 14 years of services to our trans Latinx community. But even though that we are based in San Francisco, we serve populations, LGBTQI plus in general, that comes and join us from different parts of California. We have participants that arrive from the East Bay, from Modesto, Fresno, and other areas of California. So Hola para Trans Latina serve originally only trans Latinx women. So our populations are mostly immigrants, asylum seekers, survivors of different kind of violence. And we are working undocumented. So we are working very close to different partner and sisters organizations, nonprofits, and also the cities organizations to work towards the well-being and the thrive, but not only thriving for our communities, also flourishing them and give them tools to not only survive, but also heal and get involved in our broader communities to embrace different, the variety or diversity of women that we have in this humanity. So thank you so much. I'm very pleased to be here. And
Thank you.
Okay.
Thank you so much, Nicole. Lidia Salazar, if you're here, maybe you could jump in and introduce yourself and organization next.
Hi, yes, my name is Lidia Salazar. I am a survivor and I am a co-executive director at Community United Against Violence, CUAV. We've been around since 1979. We're one of the oldest LGBTQ anti-violence organizations in the country. We support survivors of domestic violence, hate violence, and violence from the police. We primarily work with Black and Latinx survivors, many of whom are undocumented, houseless, formerly incarcerated, and I can stop there because I can share a little bit more later.
Right. Thank you so much, Lidia. Denise, I see that you're here. Would you mind going next?
Here we go.
You'll have to unmute your.
Yes. So I'm Denise Caramagno. I use she, her, hers pronouns, and I work at UCSF, the University of California, San Francisco, in the CARE program, where I provide free and confidential services to survivors of sexual assault, interpersonal violence, stalking, sexual harassment, and we also provide prevention education to our community. So all of my clients are affiliated with the UCSF. We serve students. All of our students are graduate and professional students. We serve researchers and postdocs, so our scientists. And we also provide services to staff. And UCSF is the second biggest employer in San Francisco, second only to the city and county. So we provide services to all of those people too. And also to anyone who may have been harmed by a UCSF affiliate. So for example, in some cases, spouses of UCSF affiliates who might have perpetrated harm against them, or patients who might have been harmed by our staff.
Thank you so much, Denise. Sarah Metz, if you're here, I think you are. Yes. Hi.
Hi, good evening. Thank you for having me here. So yeah, I'm Sarah Metz. I'm a clinical psychologist, and I'm also the director for the Division of Trauma Recovery Services at UCSF. And so throughout the division, we treat trauma across the lifespan. We have a children's program and an adult program. We serve victims of violent crime, which includes sexual assault, domestic violence. In our adult mental health clinic, we also treat folks who experience persecution or torture in their home country. We provide, so part of our division is the Rape Treatment Center. So we provide the forensic medical exams and forensic evidence collection for acute sexual assault survivors at Zuckerberg Emergency Department. And all of our services are free. Our mental health services are trauma, focused, evidence-based, comprehensive clinical case management, and it's all free to the community.
Thank you so much, Sarah. And last but not least, I believe we have Jill. Are you here, Jill?
Hello, I'm here. Thanks for having me. I'm Jill Zawisza. I'm on the leadership team over at Woman Inc. And we are an anti-domestic violence organization. We've been around since 1978, and we provide direct services for survivors and their supportive networks, and also have the both and of doing intervention and prevention work. And we do a lot of work with Spanish-speaking survivors and some leadership development with survivors of domestic violence as well.
Wonderful. Thank you all so much for your time. It's really an honor to be in shared community with you this evening. And I know we're going to have a really robust and wonderful discussion. Before we jump in with questions, I want to just remind the participants to remain on mute for the duration of our time together. We'll have about 45 minutes tonight for the panelists to discuss, and then 15 minutes to answer questions. And so if you're listening in and want to submit a question, simply open up the chat box and you can leave your question there. And hopefully we'll get to all of them. A reminder again that we do have Spanish translation available. The number is also in the chat box, but again, it's 605-313-5107. And the passcode is 811671. Lastly, this panel discussion is being recorded and we will be emailing it to everyone who registered to watch later. And of course, feel free to share it with others who could not attend. So with that, let's get started.
Great. I also would like to, I just want to mention, I saw that we are now live on Facebook. So for anyone who joined a few minutes late, we are live streaming. And so that is why everybody's video is turned off. And a reminder to all of our participants to change, if you don't want your name publicly on Facebook, to change the name in your Zoom box so that it's not public. And I just wanted to do a little grounding for all of us because this is not an easy topic to discuss. And so I want to invite everyone who's here today, all the participants and panelists, to be really gentle on yourself through this panel and to take care of yourself how you know best throughout this panel and then for the rest of the evening and preferably tomorrow and the days going forward, but especially right now. And our first question, people answered some of it already, but if there is more that panelists want to say, the first question is to briefly describe the work of your organization or agency and talk about who are your members, participants, or clients. And we'll start with, let's see if we can do the same order. So Nicole, will you go first, please?
Yes, thank you again. Well, ELA para Trans Latina has been serving here in the San Francisco, as I mentioned before, during 14 years now as a ELA para Trans Latina, but we have 25 years serving LGBTQI, particular trans immigrant, undocumented women. Basically, that's our main population, but we are an open space, a safe and open space for the entire LGBTQI community and also the broader community in the mission. We are based in the heart of the mission. So we provide services towards different areas. We started as a HIV prevention program during the pandemic of HIV. And now we continue providing those services, but also we have case management in our program that do accompaniments to our participants to seek aid, for example, depending on the needs of our participants. The majority of our participants are survivors of different kinds of violence, including domestic, sexual assault, prosecution in their home countries. That's why we are here. And based in that, we provide, for example, linkage with different services up in the community as well. So we also provide workshops daily. I'm sorry, my parrots are alive too. So we provide services in our communities towards healing as well, and cultural approach and trauma informed. I'm art therapist. I've been doing work in art therapies for almost more than 15 years now, and I'm also working towards a healing journeys and healing process to help our survivors, our participants, to navigate and find the resources that we are needing in our communities. Even that our survivors, our clients are also very resourceful themselves, but we are just an aid, a help, and a compassionate organization that works with them, for them. Thank you.
Okay, I think next, trying to remember the order, but Lidia, I think you were next.
Yeah. So Shokooh has again been around for about 40 years now, and we started with our community members asking, how can we keep ourselves and each other safe? At that time, our community, and still now, was facing a lot of violence from the police, and our community members weren't able to access safety or support from law enforcement. So that's how Shokooh came into existence. Yes, and we provide support through counseling, peer advocacy counseling. We also provide support groups to develop healthy relationship skills, and like such as boundary setting, listening to your intuition, and really practical skills that sound easy, but we all know are very difficult to practice, especially when we have to interact with other people. We're not just doing that on our own. So we also have a participant to member pathway, which allows survivors, we are the survivors that come to Shokooh participants because they're participating in their own healing, and they have an opportunity to then later, when they're ready, if they're ready, to develop their leadership skills and start to engage in community advocacy and organizing. So we are do some organizing around immigrant rights through the Free SF Coalition, and as well as the Known USF Jail Coalition, along with the Domestic Violence Consortium and the National Coalition of Anti-Violence Programs that are all LGBTQ specific.
Thank you. Denise?
So as I said, we provide services to any UCSF affiliate. CARE's been around for only 5 years. It came about as a result of student activism. Students on some of the UC campuses felt that the survivors' needs were not being addressed appropriately. And so I always, think of that when I do my work, that I'm here because of the students and because of their demands. And so I know who I serve. Some of the stuff we do accompaniments if people have to go to court or they need to, go talk to a supervisor about something. We will go with them. We do academic accommodations and workplace accommodations. We provide support groups, therapy. I'm a therapist. We try to provide different healing modalities, and then we connect people to other community resources. And as I said, we also do a lot of the prevention education. We have a group of student activists who are the CARE ambassadors who spread the word on campus and amplify the voices of people who have concerns.
And I think it was Jill.
Yeah, I think I partially answered this question in my intro, excuse me. But I guess what's left to say is, our mission is to support survivors and their loved ones along their healing journeys. And we try and build networks that meet the intersections of violence. So we have a lot of partnerships with organizations that perhaps provide services that we don't, or that we don't provide as well as they can. And we really try to center marginalized communities in our program building and in our work. And we are really proud, I think, of our culture of care in our organization, not just for participants, but also for our staff, volunteers, and board. So we consider all of our volunteers and program participants as a part of our very shared collective community. And we work really hard on building a supportive culture that can help people assess like what service maybe works best for them. But we do a lot of advocacy, case management, we do accompaniment, therapy, support groups, healthy relationship building. So we do a lot, just like everyone else here on the panel does.
And Sarah.
Yeah, so I can expand a little bit. I'll just focus on the adult side since that's probably the most relevant. So as I mentioned, we have the Rape Treatment Center, which is the only program in the city that can collect forensic evidence collection for acute sexual assaults. So we have that service. During the day, one of the Trauma Recovery Center clinicians, also it's a multidisciplinary response, will respond to the emergency department. Pre-COVID, that was obviously in person, but we're now doing it over the phone, and I think we'll get to in a little bit kind of the adaptions we've made overall. And then in the evening, we partner with San Francisco Women Against Rape to provide advocacy if that's requested in the evenings and on weekends. And then, so for the Trauma Recovery Center, again, we provide evidence-based, evidence-informed, short-term, trauma-focused therapy and clinical case management. We provide services in a variety of languages. If we don't have the in-person staffing, we have a relationship with Newcomers Health Program, where we have other in-person interpretation options. And if that doesn't meet the languaging needs, then we also use over-the-phone interpretation. We do all kinds of assertive outreach and clinical community case management. So whether it's accompanying folks to court, to make a police report, coordinating with other agencies, just to meet, the various needs of our survivors. We also have different programs within Trauma Recovery Center, one of which I mentioned, which is Survivors International. Through that program, we serve folks that have experienced persecution or torture in their home country. We also do provide asylum evaluations, both psychological and medical. We offer individual therapy. We have a couple groups that we run, one in English, one in Spanish. We also have a speakers bureau. So for survivors that have completed or participated in treatment at Trauma Recovery Center, we have kind of a process that can help if it's part of their healing journey, where we have a certain model that we use to help folks to speak publicly about their, their experience. They speak in a variety of locations, whether it's other community mental health organizations or even with legislation. And this year we're really excited. We are starting a Spanish speaking speakers bureau. So we're really excited about that.
I think we're ready for the second question. So the next question is really to ask our panelists, what are some of the big issues that you're seeing now compared to your work prior to COVID? So really in terms of your services, have any of them shifted, any new or extra challenges? And maybe specifically what the extra barriers are that survivors are now facing during shelter in place. And why don't we start with Nicole?
Thank you. Yeah. Well, basically, I think that as many of the rest of the organizations who provide direct services to our clients or participants, one of the things was the challenge how to come together to continue providing those services to our participants, where the shelter in place was, the ordinance was placed, you know. So we were able to change or shift our program totally in a remote format. So we do live stream on Facebook, and also we implemented a warm line, a kind of improvised warm line to we come together with all the names, with all the data that we have of our participants, with the phone numbers, emails, etc. And we create the list, a list to each one of the staff members of ELA started to call each one of our participants that to know how they were, what were their needs in this, or what are their needs in this moment. So that was something that totally changed, and it was shifted in person in a community that Latinx community. It's a very in person. Always our interactions are very based in community, and we are very rooted in that. So when the shelter in place ordinance arose, was like the big challenge, like oh my God, this is going to be challenging. This is going to be a real we need to work fast and improve the way that we provide the services. So those are this was the first, like a main shift that we did, that we turned totally our program, but entirely our program online. So, and it was pretty successful in a very time manner as well. So I'm very happy with the team and with all the support that in community that we have. So, and the barriers that I'm seeing now, or it is nothing new. Basically, when we are talking about a diversity of women, or a diversity of identities and sexual orientation, or the variety that we have in our societies, when it comes from, for example, for homelessness, when access to shelters or access to other kind of services in health, mental health, and other services, the barriers are the same, but increase totally. So, for example, the myth that we have in our communities about how the survivor of domestic violence looks like, and how the persons who are doing the assessment of the survivor, how can be shifted, or how they can be perceived different, our participants, because they are trans, or because they are with a different identity, or gender non-conforming, or immigrant, undocumented. So those kind of barriers are increased right now. Homelessness is increased now in our communities, and the challenges for example, those asylum seekers, or those people who were seeking or have process in their cases, in their immigrant cases, are stopped, paused, or they don't even hear anything back from the offices in this kind of situation. So the barriers are also the violence that people are suffering in the streets, the barriers to, for example, access work, and how our participants, how our communities who have been living in vulnerability and invisibilized from the main services, now it is worst and bigger.
Thank you, Nicole. Thank you for that perspective. Lidia, to you next.
Yeah, so I really resonate with what Nicole shared about some of the barriers that are still present right now for our queer and trans communities, like homelessness, high rates of incarceration and deportation continue to be an issue before and now in this pandemic. And I think what's been really hard is this narrative that continues to amplify the the voices of domestic violence, but it being a women's issue. And I think that leaves out a lot of our queer and trans community members who are, you know, struggling to survive, but also struggling to be noticed as like someone that needs help and needs these resources. It's really difficult to access services when you're already, like, for example, some of our participants are formerly incarcerated because when they reached out for help, they were also arrested alongside their abusive partner. And so that's often like, there's so much data that is available that shows how often this happens, even in San Francisco, given that it's a mecca for queer and trans folks. People are still incarcerated when they're seeking help at sometimes. And so with that also discourages people from seeking help outside, right? Like either they're coming more often to community organizations like ours, like Ella, like Women Inc., all of the organizations that are on this panel. I'm really grateful for all of you because you know, it takes all of us to build a strong support system for the people that we're supporting. But I do feel like we need to continue embracing all of our identities when it comes to when we're speaking about addressing violence, because we are all affected. So
thank you. Thank you. Maybe to Denise next.
So, so before the pandemic, we focused a lot of our resources on offering different alternative healing modalities with, you know, the acknowledgement that not everybody wants or benefits from therapy. And so we had explored different restorative practices like trauma-informed yoga, sound healing, art healing workshops, and just other modalities to offer people ways to heal, like even somatically. And we did our best to make that really accessible with things like transportation stipends. And so with the pandemic, we've had to move everything to, you know, a virtual platform and or to provide services by phone in some instances. And so to try to figure out how to do that in, you know, in this situation has been a challenge. We're setting up support groups online, and we are finding creative ways to continue to offer healing services. One of the bigger challenges is that not everybody in our community has access to a computer or has Wi-Fi, and so we're looking for ways to reach those people and to continue to stay connected with those members of our community.
Thank you so much, Denise. Sarah?
Yeah. So the Rape Treatment Center, the services are still being offered in the emergency department. You know, folks, anybody going on, you know, into a building at Zuckerberg will be screened for COVID. You know, all the providers are wearing appropriate PPE. We have had to make some just minor adjustments in some things just to prevent, you know, just to prevent exposure for folks, but all, you know, the services that Rape Treatment provides are still up and running in the emergency department. For the Trauma Recovery Center, we have also successfully moved all of our services remotely, either via phone or Zoom video. So we're still taking new referrals. We were very pleasantly surprised by how many folks did have access to at least a phone. We were really worried that we were going to lose, contact with a large number of our community, but we were very pleasantly surprised that most folks had some way to contact us, which was great. And I'm just getting really amazing feedback from the clinicians about how engaged the clients are, which was also kind of a concern. But just hearing just these ongoing amazing stories of healing that's still happening in the context of the pandemic. So that's been really fantastic. We are also still offering our groups over Zoom. We've actually noticed increased attendance to our groups. So it's I guess there's silver linings in here, and that we're learning, different ways to increase access to services. And then I just want to make sure, I feel like I'm leaving something out, but I hope not. But if I am, let me know.
I think you covered it. Yeah, thank you,
Okay.
Sarah. Yeah, and to Jill next.
Yeah, you know, a lot of what the other panelists have said is true with us. I think when this all first happened, when those orders went into effect, we run the city's domestic violence support line, and the call volume doubled. It was a huge increase, and that leveled out over time. But what happened was there was an increase in requests for shelter and for like support group, for counseling. And so a large element of what we do was already planned essentially to be done remotely. So we had to implement a few new things, but we logistically it wasn't super complicated. But what we've seen with participants that were already established, and then with people coming in, is an escalation in violence pretty much across the board in a really serious, scary way, where if there was physical violence before, it's escalated, and the lethality checklist is just getting check. It's there's been an increase. So we help PROC, the Cooperative Restraining Order Clinic, do the restraining order intakes, and there's been an increase in requests for restraining orders. While when this was all first happening, it went down. Now it's increasing. So I think it's going to be interesting, kind of with some space between this pandemic and for us to be able to kind of assess those trends and look at that. And as always, anytime a survivor, any element of their identity that's been marginalized by, you know, capitalism and racism and patriarchy, it's that much harder for them to connect with us and stay connected, because, like has been brought up with all of these lovely panelists, not everyone has Wi-Fi, not everyone has a phone, not everyone has a laptop, not everyone has a door they can close and be alone. And this is especially true, I think, for a lot of survivors. What gets taken away from them over time is their privacy and autonomy. But if you're dealing with someone who's houseless, it's even more so. So I think the trend basically that we're seeing is an escalation in all types of violence and all types of oppression, in all types of violence that happens to marginalized folks in our world here, in our city, and across the nation.
I did remember, I'm so sorry, kind of one other part of the question, which Jill, thank you, you reminded me that I think would be important to speak to, which are barriers that our community is experiencing during this time. And I think we've seen, especially in April, a significant reduction in the amount of folks that are seeking services over at the emergency department, for example, more than a 50% drop. And we are also extremely concerned about who we're not hearing from and who's not seeking services, and being very anxious in terms of how to let them know that we're here, how to make contact with them, because we are, you know, very concerned on the child side as well about the amount of child abuse that's happening in the home, as well as intimate partner violence. So I did definitely want to echo and highlight that is very much a concern and a barrier as people seeking services right now.
Thank you, Sarah, for jumping in. It's hard to have a conversation in this format. And so if there are thoughts that each of our panelists have throughout this conversation, if you want to echo something that somebody says, I welcome, we'll figure out a way to navigate that so we can have more of a conversation here. And so going forward, most of you have touched on this already, but COVID-19 and the shelter in place has really highlighted the system failures and the already existing inequalities in our society. And examples of these are like access to health insurance, access to housing, food, mental health services. You know, we've seen the over-criminalization of some communities versus others. And so I'm wondering, how have you seen this play out in your work with with survivors of sexual violence and interpersonal violence? And then the second part of that is like, what can we as a community do right now to support survivors? And I'm going to mix up the order a little bit. Let's start with Denise.
Oops, I was trying to follow that question. Can you repeat it a little bit, like not the whole thing, but give me a piece?
Sure. Yeah. So the question is, like right now we're seeing existing inequalities highlighted within our society. So the question is, how are you seeing that in your work? How is it showing up with the survivors that you're working with, specifically since this panel is on trauma? Like, has it manifested in different ways in that way? And how do we support people?
Okay, so I guess one of the things that, you know, I've noticed, I mean, I think as we've mentioned, that sheltering in place can be really dangerous for some people, and that it's challenging for people who have no privacy at home or who are living in conflicted relationships to, you know, to even be able to communicate with us. But another thing that I notice is that the issues and that the feelings that are highlighted by the pandemic are some of the same issues that survivors often struggle with in the aftermath of sexual assault anyway. So for example, after a sexual assault, people sometimes feel anxious or isolated, or, you know, they might have heightened concerns about safety. Maybe they struggle with trust. Like, those are all kind of themes, I think. And these are the same things that are coming up as a result of the pandemic. So one of the things that I'm seeing is a wave of, you know, former clients coming back for services because this situation is amplifying things that in a lot of cases they felt they'd already worked through, you know, and so it can be really discouraging. And I've been trying to normalize that for people. Like, of course you feel anxious and you're concerned for your safety. You know, a lot of our people are frontline workers, and, you know, some of our people are, you know, working at nights cleaning the hospitals. And so they're in situations that aren't necessarily safe at work also. And so, you know, just trying to remind them that that doesn't erase all the progress that they've made, because they're experiencing the situation the way that so many of us are.
Thank you. Let's say Jill.
Yeah, Denise, a lot of that resonates with what we're finding too, reconnecting with folks who have been out of their relationships for years in some cases, who are feeling very triggered by all of this, and those feelings of isolation and disconnectedness are just putting them right back where they used to be in terms of how they're experiencing this. And I know, so I'm thinking specifically with our Latinx program, a lot of folks are either essential workers. So we know that we worry collectively about essential workers being protected at work and having proper equipment. And there's the element of, you know, are we exploiting these people? You know, and some of them have lost their jobs. Maybe they, you know, have issues, you know, maybe they're not documented, so they're basically cut out of a lot of the aid that I could go easily apply for because I was born here. So here we are again. It's like someone's always getting the fuzzy end of the lollipop, and most of the time it's not people that look like me, right? And it's equally worse for a lot of our clients because they're really not able to access support that some of us take for granted. So we're basically hustling to figure out how we can get people's needs met and even assess what they are right now. And in terms of how people can help, I've been really awesome. It's been really awesome, the response. Like, we've gotten an uptick in like donations of like $25 that we can take and buy gift cards with. You know, I've had people call and be like, I'm so worried about a friend, and I don't know how many times I've sent out our safety planning and sheltering in place images, like a lot, and directing people to our blog to read more about it. So there's been a 10% uptick in calls on our hotline placed by friends and family looking to support survivors. And I hope we're able to kind of we're building this collective empathy, I feel like. And I really hope that that continues throughout and past the pandemic.
Nicole?
Well, I'm also resonate what Jill and Denise have said, but one of the things that I would like to add, it is that it is very challenging to come to our daily workspace with the knowledge that healing is a life journey. So many of our clients, the majority of them, if it is not all of them, are survivors of different traumatic events. And now we are living a collective traumatic event as well. So how people are also connecting one event from the past with events that COVID is bringing up again. Because I've been seeing, I'm in the position that I am now. I'm not a counselor anymore, but I had to jump in sometimes to give a call to some participant that it is in need because they are in distress. So one of the things that I've been noticing, it is also the shelter in place, as Jill and Denise have mentioned, it is not a safe space for many of our participants. Many of our participants are sheltered with their aggressors, or many of our participants have experienced again that their aggressors, if they were able to leave the abusive relationship, their aggressors looked and come back to the place again to seek help of our participants, so or help the survivor. So that is an adding of this trauma, a collective trauma that we are facing, but also the personal trauma or that any kind of violence have happened in the past, because batterers know where the people lives, you know, and now that they know that they are in their places, it is easier to seek them again and look for them again. So it is a challenge to how come together with this you know, I think growing ages that we have in our communities and also in our agencies that we still have, especially when we are talking of different identities and how these identities are taken or are seen as valid in the society. Because a trans woman in a reality of a person who is living a transgender experience, sometimes we don't get accreditation of our experiences. So that's something that it's very important, that I would like to mention, that it is the validation and how we perceive different identities in our society. It's something that we need to do better, and we need to increase the awareness, not only in our agencies, in all the communities that we might have an impact. Because as I mentioned, healing, it is a life journey, but sometimes, and generally the majority of the time, our participants are re-victimized and are re-traumatized, living violence experiences over and over and over again, especially if you are trans, especially if you are homeless, especially if you don't have a job, if you depend on the person who is causing you harm, or if you were able to escape that situation to leave that relationship, that they are seeking you again. So, and when you don't have the possibility to go to a place that somebody's going to believe you, it is super hard. And also when you don't have access, for example, to get into a shelter, for example, for in a case of domestic violence, that has been a challenge for our queer and trans and gender non-conforming communities, that they don't have the same access, or they don't have the same line of priority when we are seeking services. Mm-hmm. So, yeah.
Thank you. I'm really sitting with what you're saying around not only believing, but honoring people's identities and experiences, and respecting those so that re-victimization doesn't happen, especially for survivors. Let's see, I think Sarah, why don't you go next?
Yeah. You know, I think our folks, you know, continue to struggle with getting adequate housing or safe housing. And I think, you know, even now the housing can in some ways increase their risk of exposure because they're group settings. So they, you know, are just almost being a little in more vulnerable situations. You know, I think because other agencies are at reduced capacity, you know, oftentimes we're wanting to link folks, for example, for longer term care or a higher level of care, and there's long waits, or other agencies aren't operational. So even connecting our clients with resources that we historically could connect them with, those resources just aren't available. So it's, you know, it's been just kind of supporting their psychosocial needs a little bit more difficult. And housing was never easy, but now it's even more difficult.
And Lidia.
So I think that this virus has really highlighted how inequality equals to death, right? And I think that this is something that we see through the way that it affects communities of color, specifically Black communities. And this is something that, you know, has always resonated with KUAV and the folks that we serve, who haven't had access to support in the way that some of us have, especially around housing. A lot of the folks that we support are houseless, living in tents, aren't being admitted into shelters, are not letting, you know, or when they're admitted into shelters, they're not being treated with respect and with dignity. There's a lot of homophobia and transphobia that they experience, not just in the hands of law enforcement, but also by service providers, right? And I think that this is a good opportunity to continue to investigate inside our own biases and our own internalized, like, homophobia, transphobia, and internalized racism, right? Because if we're just focused on the interpersonal piece and not connecting into this, like, institutional level and this collective level, then we're not going to be able to end violence. And I think it's really beautiful to see our members at KUAV. Just yesterday, we had a membership meeting, a group of survivors that, you know, we just had a loose agenda and we just kept it more open, and they got to interact. Like, there was like 1 or 2 questions, but they really just got to be there for each other and to witness each other's, like, resilience and power. And that was just so special for all of us, right? For us as service providers. And it was just such a collective, like, healing that happened yesterday in like an hour, right? So we're still continuing to try to look for ways to humanize, like, this virtual reality that we're in, that some of our survivors are able to access, right, through Zoom, but some are not. So it's like phone calls and leaving signs on our office. You can call at this time, I'm going to answer, or come back at this time and I'm going to be at the office so that I can provide, you know, vouchers and emergency assistance, a quick hello, and, you know, like, what is this, like a gesture of hugs, right? Essentially, but these are like the small things that have like really impacted all of us at KUAV and the people we serve.
Beautiful. So actually, I'd love to start, Lidia, with you for this next question. You used the words sort of a collective healing opportunity, and even the word beautiful. You know, these are really dark times filled with challenges that I think none of us could really have imagined just a couple months ago. But it's also really a moment to reimagine the world as we want it and to collectively build it together. And so this question is really about what you see as the opportunities that the crisis provides us. What is the one thing that brings you hope right now?
Woo, that's hard. But in the midst of all of this crisis, I think that there's a lot of political organizing that's happening, organizing around, you know, immigrant rights and rights for those that are incarcerated right now. And so there's this big movement, like a moment where all of our movements are coming together to amplify our power, right? Our collective power to create change and change these conditions. And like, I think that gives me a lot of hope that we're not just like addressing these short-term, like, we're not just doing like short-term fixes, but we're also looking at the bigger picture and looking for ways to dismantle this really broken system and to create new programs and community where we can like support one another. And I see that within like organized spaces, but also like in small, like in some of the survivors that we're supporting, they're like sharing how within their household or within their community that they're able to like check in on each other or just like provide some like care for one another. It brings me a lot of hope. So that wasn't just one, but
that's great. No, thank you. We all need more than one, so that's fabulous. Thank you. Yeah, maybe Sarah next.
Sure, thank you. Yeah, I think I mentioned this earlier, but I've just been, you know, so taken aback by the clinicians' reflections and successes that they're sharing, you know, with the clients that they're working with. It's just been awe-inspiring, you know, to hear the work that people continue to do, even amidst the context that, yes, you know, folks, you know, will still, you know, will reflect on the impact, but they're like, you know, but I came to your clinic to do this work and I want to continue to do this. So that's been amazing. I think on a more, I guess on a larger scale, it is absolutely not perfect and it is not capturing everybody. But I have this fantasy that as we're housing homeless in hotels and motels and we're trying to staff them with mental health providers, let's keep doing this. You know, let's build on this momentum and let's continue providing this resource. And, you know, I don't know what's going to come about of that, but I think COVID has basically shown what's possible in many, many different respects and what's possible in pretty short order. And so, you know, I'm just really excited to see kind of how that momentum might continue.
Great. Thank you for that. Nicole?
Well, I resonate a lot with Sarah and Lidia having said. I think that also COVID has brought us, you know, kind of the awareness of our humanities and the fragility that we all have and we all share as human beings. So one of the things that gives me hope, it is, as Lidia mentioned, how we have been coming together to work to support each other. That gave me the opportunity to know more about my neighbors, to know more about the community that we are all in. And I think that that's my main hope, that we can create actually a new society or new communities where all are included, where all are accepted, when all are respected and all are appreciated or celebrated. So I think that that's a main hope that as popular saying for the Zapatistas that it says that where all the worlds are included in one world. So I think that that's my main hope, that we all see our human faces behind this emergency, behind this COVID-19, and create the awareness, but under the lens of the awareness that we are all in the same storm, but we are not all in the same boat. So we need to create this collective boat that we are all included and nobody is left behind.
Beautiful. Thank you so much. Denise, your thoughts on this?
Well, I'm also like really excited that we have demonstrated that we have the will and the ability to empty the jails, you know, to house the unhoused. Like for some reason we couldn't do it 3 months ago, but now we can. So that's so hopeful to me that we could dismantle some of the structural violence. It's, you know, we see that it's possible. The other thing that's been really inspiring for me is the creativity and the collaboration that I see come out of this, that the art, the music, you know, the resiliency, and just to see people come together in this way makes me feel very hopeful.
Thank you, Denise. Jill?
Yeah, a lot of what's been said, I agree with, and it gets me. I think, you know, speaking from the eye, moments of crisis, especially doing this work, we are constantly confronting them because others can't, or they won't, or, you know, for whatever reason, and it can be really difficult to kind of move through and pass crisis and learn from it and then adapt, you know, and be not always in crisis mode and feels this scarcity. But I think it's interesting about the pandemic is at first it felt very crisis laden, and it's still does, you know, and also it's shown, like everyone on the panel has mentioned, we've adapted to it. We've looked at our policies, our structures, our procedures. We saw that, you know, putting people in jail, maybe that's not what we need to be focusing on right now. Maybe we need to focus on some different things. And the way that our participants, and it's something again that's been mentioned, the way our participants are coming together and sharing resources, and just like calling me and seeing how I'm doing, and they don't need anything from me. They just want to know that, like, everyone that I work with and I are well. You know, it's that connectedness on the level of like a human to human connection that will get us through this crisis, and I think others. And if we can assess our priorities and the systems we have in place, it might make it so that kind of connection is not only easier but more impactful. So yeah.
Thank you.
I really just want to honor each and every one of you for your resilience and your long-term visions. You all do really powerful and really extremely important work in our world. And so, having said that, we were planning on answering some questions from community, and there's a number of people here. So I'm wondering if the panelists would feel okay staying for 2 questions. And it's 6:34 right now, so I want to respect people's time. If the answer is no, no is a great answer. But can I get maybe a thumbs up or a thumbs down? Okay, great. So having said that, there is a chat box here on the right side of your Zoom window. If anyone has any questions, please, now is the time to write in. So there's not a question, but a comment from somebody who just wants to thank all of you panelists. The person says that I have worked closely with some of these agencies and they have been so helpful. That's great. Yeah. And maybe while we're waiting, I also want to plug if people want to donate to any of these organizations. I know you all are on the ground and are constantly fundraising. So if you feel comfortable putting in a website or a number or a place where people can go to get more information or to donate to your organization, put that in the chat too. Let's see. Here we go. First question. Do we feel that a victim-centered approach, it's moving. Okay. Do we feel that a victim-centered approach requires an adjustment given that given the viral crisis? What could be an example? And I'll just open it to any panelist. Again, the question is, do we feel that a victim-centered approach requires an adjustment given the viral crisis? And what's an example of this?
Unless anyone else wants to jump in, I think anytime we do survivor-centered work, we basically are in a feedback loop with our folks and figuring out what resources we have, what resources they have, how do we figure out and assess what's needed at this moment in time. So for our folks, for instance, we had a plan to do a fundraiser, in May, and so we had put aside a little bit of money, and what was coming up as an example for a lot of folks was they weren't able to pay for food, a couple of them, and a couple needed just a couple $100 for rent, that sort of thing. So we were able to take that unrestricted money and buy some cards and give it to them. So just as an example of a survivor-centered approach, I hope that answers the question.
So maybe I'll read the second question here is, would it be possible to share contact information for each organization for donation purposes and or volunteer opportunities? And I think I can even answer that because I see here in the chat box that people are already putting in website addresses, and I'm fairly confident that we could probably add that to the material that is emailed out to each person who registered for this conversation tonight.
Maybe our last question can be, how are service providers reaching houseless survivors at this time? And how can we support houseless survivors as community members?
I mean, I can share for the Trauma Recovery Center, we're using whatever resources they have. So if it's phone, if it's a case manager's phone, like if they are in an SRO or something like that, or a shelter, so we're trying to just find ways, or if they can borrow somebody's phone for a little bit. So we're just finding ways to really contact them. As I mentioned earlier, I was pleasantly surprised about at least the volume of folks in our clinic that had access to a phone, but if they don't, we did get some donations for telehealth equipment. So we do have some phones that we'll be able to provide to clients that we can connect with them.
Yeah, we've just continued to keep in contact with shelters and other service providers that work closely with houseless folks. And through that, we just open up our doors and let them know that, you know, we're here to support, and we try to work together to reach the survivor that's in need of support from KUAV. And then also from the people that we're already connected to that are houseless, we have a set time and date that they know that they can come by and we'll be in the office. So we try to come into the office once a week. We maintain social distancing, and we, you know, try to figure out how we can support them at that moment.
Okay, in order to respect everyone's time, I think we'll wrap up there. So I want, actually, can we have the screen back for one more moment? Because there were a few really beautiful comments of just people are showing their gratitude to all the panelists in the chat window. So I want to make sure that you all get to see those. And there are some resources being shared here, so we can include those in our follow-up email that will go out to everyone who is registered for this event. And with that, I think there is an announcement. Dr.
Yes.
Yes.
Yes. So I just wanted to mention before we all say goodnight that we are having a series of these virtual town halls. We would love for you to join us for the next one. This is a program that's part of an exciting new partnership between the Commission on the Status of Women, the Human Rights Commission, and New America. Our next event will be held on Tuesday, May 19th at 5 p.m. And it will be entitled Building Community and Safety for Domestic Violence Survivors During COVID-19. And then following that, on Thursday, June 2nd, we will discuss how to support women-owned businesses in San Francisco. The registration information can be found on the website for the Department on the Status of Women, which is sfgov.org/DOSW, another resource that we will be sharing with everyone. Thank you all so much for joining us.
Thank you, everybody. And thank you, a special thank you to our panelists. You all are incredible.
Thank you all so much for the work you do.